My name is Victoria Cox, and I am a fourth-year medical student at the University of Kansas School of Medicine, Kansas City campus. And my research was issues in adolescent and parent communication involving participation in care. So I started to design this study when, in between my first and my second year, they offered a fellowship sponsored by the Department of History and Philosophy of Medicine. And I was trying to come up with something that I could use to apply for that. And I started thinking about my first experiences in healthcare, which for most people is when they go to the pediatrician or the family physician as a little kid. And as I experienced clinic opportunities during my first year, I realized that my experience was a little bit different than what most people experienced. As soon as I turned 14, my mom sort of threw me into the deep end, and I went into the doctors by myself, and I made all the decisions. But I saw that that wasn't really the case for most people. And so I started doing some research, and it seems there's a little bit of a controversy about how to include adolescents, how to make them feel empowered. So some of the research actually suggested that children as young as age 7 have the ability to give assent in the doctor's office, while other studies suggest that this ability doesn't exist until age 11 or 12. And then there are also these variations in parenting experiences and approaches and culture that really vary how people experience healthcare and how they allow adolescents to participate. And this really creates sort of an interesting situation for physicians who are trying to balance adolescent autonomy, as well as making sure that the parents feel incorporated into decisions and making sure that the best thing is happening for these adolescents. So in designing this project, I was hoping to be able to characterize these interactions between parents and adolescents, to look at how they thought about healthcare decisions, how they thought and felt about incorporating adolescents into making these, and what that actually looked like. So what we did is we created a survey that the parent and the adolescent took. Some of the questions were different, and we distributed those to adolescents between age 12 to 17 at one of the pediatric clinics at KU. And we gave these to them before they went in for their appointment, and they gave them back to me at the end. And so what we found is quite a lot of interesting information. So I'll start with what the adolescents thought. So 84% of adolescents agreed or strongly agreed that they want to be involved in their healthcare decision-making. And 81% agreed that they were informed enough to actually help make that decision. So they feel very empowered and they want to be involved. And we actually found no difference based on age when looking at whether or not they felt informed enough to help make the decisions. And so we actually split them out into 15 or older as our older adolescent category, and then younger than 15, just to look at maturity levels to make sure that it wasn't like the older kids all said that I felt really informed versus the younger kids thinking not, but we did not find that. So then when we looked at the parents, we asked them several questions about how they thought about incorporating their adolescents. And so almost 89% of parents said that they agreed or strongly agreed that their child should have input into their medical decisions. But only about a third of them said that they thought that their child should have the final decision on what was happening to them. And we found that there wasn't a difference based on age if we looked at the group of older adolescents or younger adolescents on parents saying that they thought that their child should have the final say or need to make medical decisions on their own. But when we separated out to age 17, we found that parents were more likely to report that their child was ready to make medical decisions on their own. And so we decided to separate them out like that because at age 17, adolescents are about to become adults, about to be in charge of their own medical decisions. So we wanted to see if parents thought that their kids were ready. And so based on that grouping, we did find a statistically significant difference for that. We also wanted to see how adolescents felt about being with the doctor individually, one-on-one, if they had enough time. And looking at that, only about a third of adolescents report that they often or always have enough time like with the doctor on their own. whereas about 72% of parents say that they think that their child has enough time. So there's a little bit of a discrepancy there. And one of the interesting things is older adolescents were not found to be more likely to report having enough time. So there's no difference based on age. A couple of the other things that we found that I don't have figures for, but I think are interesting and really contribute to the conversation, is we looked at whether or not adolescents felt control over what happened to them at the doctor's office. And about half of them said that they felt in control. And this did not differ significantly based on age either. And we also wanted to look at parent and adolescent communication in the doctor's office. So who was reporting symptoms, who spoke more, those sorts of things. And we found that 90% of parents actually report the child's symptoms to the physician. And 56% of them summarize what the doctor has said to their child. And there was no significant difference based on the age of the adolescent on whether or not they were summarizing to their child. There was also no difference based on adolescents' reports of understanding and comprehension of what was going on. So I think the discussion that this sort of generates is, how do doctors balance that relationship with the adolescent and the parent? I think really what we can take away from this is that adolescents really want to be involved in their healthcare. A lot of them feel like they're ready to have input. But parents seem to think that their child doesn't really understand what's going on. They don't know that they're ready to make the final decision. Most of them don't think their child is ready to make decisions by themselves. And so sort of the idea is that maybe doctors can foster this and start allowing adolescents to have a little bit more of a say, talking with the parent and saying, this might be a good time to start introducing the idea of them making decisions and sort of facilitating those conversations so that we can empower adolescents, as well as give parents the support of feeling like their child is able to make decisions with the support of themselves and the physician. Another thing that I think this really highlights is that adolescents don't think that they have enough time alone with the physician. And I know one of the things that could confound that is the shortness of visits. So we didn't talk about like if they would want more time overall in a visit or more time alone. But that's something that definitely should be kept in mind, is that adolescents are thinking that they don't have enough time, but parents think that they have plenty of time. And so building that space to create that conversation could be really helpful in facilitating the other conversations of we want to support adolescent autonomy in making decisions. Some of the limitations that we had with the study is it was a little bit small. So we had 60 parent-adolescent dyads. But one of the other issues that I think sort of limits its generalizability is the fact that looking at the demographics, the majority were Caucasian. And when we looked at parents' education level, about 85% of them had at least a bachelor's degree or a master's degree. And I think that that's simply because of the clinic location. It's one of the off-campus locations, whereas a lot of the lower socioeconomic status patients actually go up to the KU campus. And so I think one of the things that would be interesting going forward is looking at a broader population and trying to get more information. And that will allow us to create sort of individualized conversations. But I think the big takeaways here are that adolescents really want to be involved, and parents seem a little bit hesitant. And so it really could be beneficial for building adolescents' confidence and autonomy for physicians to facilitate these conversations so that they have more say in what's going on.
I think that's really good. I like all your graphs. It's easy to read.
Thank you. I really struggled with the font size on the computer. It looks great printed out, but on the computer, it was a challenge.
Well, that's part of why, yeah, I was trying to get all this to work on my computer instead of on my phone, because I was like, there's no way I'm going to be able to read that on my phone. So yeah, I think This is really interesting. Another thing you meant, or something that came to my mind, the demographic side of things is I really wonder if this is sort of our sheltered adolescents versus our sort of hard knock life adolescents who maybe had to grow up faster in perhaps a more socioeconomic demographic. And it would be really interesting to see what the difference is there. I mean, you kind of touched on that, which I think is really good. What was your age definition of adolescent? Was it traditional 13 to 19, or was it like 11 to?
We defined it as 12 to 17.
12 to 17. Okay, yeah, that's what I was wondering. I guess I figured it was 18 or whatever, but I didn't know about the bottom end. I feel like even compared to when I was a kid that we're seeing adolescent problems and 10, 11, 12-year-olds that we maybe didn't, or I didn't know about. Maybe I was sheltered. I'm sure I was sheltered. So what was I going to ask? Oh, one thing that would be also interesting, I think, would be if there's a difference in adolescent willingness or desire or parents' confidence in their ability to make decisions if it's a child who has, say, a chronic illness, who's been dealing with health questions throughout their life, say diabetes, asthma, maybe a childhood cancer survivor, that sort of thing.
We had questions on the survey asking about chronic illness to determine sort of whether they would have those experiences. We just didn't have enough patients who had that to be able to do stratifications based off of that.
Sure,
We
that
were
would be really
hoping that maybe we would be able to capture that, but we weren't able to.
Yeah. Well, maybe if you expanded it, or added different clinics, different demographics, you might find that, or just numbers, But I think it's I also wonder, would there be a difference in, say, a pediatric clinic versus a family medicine clinic, particularly a family medicine with pretty good continuity? You know what I'm saying? Like
Right.
Where the doctor has known the child since they were small. Is there a different comfort level, or they the parents and the grandparents and the brothers and sisters, and that gives you a lot of insight sometimes. And I think I hope maybe makes parents more willing to let their child participate, and maybe I hope makes our children more willing to ask questions and feel comfortable and not be intimidated, because I wonder how intimidating that is.
Yeah.
I feel like I don't remember being an adolescent, but so
Yeah.
Anyway, this is a really interesting topic. I think you did a really good job.
Thank you. Yeah, and I think really the way forward is looking at more diverse clinics, more different experiences. We were really limited. I had to be there to administer the surveys with how the clinics were running. And so I could only be in one place at a time.
Sure, yeah.
And so I think even if we just were able to expand to like clinics across KU, like I think that would give us a better picture, because my faculty advisors and I talked about how this is sort of like you said, a sheltered sort of adolescent. Like that could be the population that we're looking at just based off of what the clinic we were in.
It's really neat though. I mean, it makes you think. It's a good reminder to me that teenagers want time with the doctor alone. Sometimes they feel like time is such a barrier sometimes. And I noticed for us, we find a lot of times our only contact with adolescents is their school sports physical, right? And so you're trying to cram a year's worth of, patient education and anticipatory guidance and everything else into what's now a 3-page sports physical instead of 1 page. And so, yeah, time is definitely a constraint. I think that was great. Michelle, do you need any thoughts? Anything I need to do?
No, I think that was wonderful.
Thank you.
Definitely made me think back to my experience with my family physician growing up. As Dr. Gruenbacher alluded, I saw a family physician who saw my parents and my grandparents and my extended family, and went to the same church as me. So, I mean, I felt like I was able to be a part of my healthcare decision making, but I don't know if I would have felt that way had I not had that type of an experience with my family physician.
Yeah, I think that's true. And probably in, in maybe you would see that in a smaller community too, even if it was a pediatrician, because you might be going to the same church or the same events or whatever. But that is definitely kind of an interesting angle that we don't always think about in family medicine. So.
And we had a few questions that tried to capture like comfort level with the physician. We asked about how many times they had been to see this physician. And I don't have it right off the top of my head, but I think most adolescents reported comfort, but we didn't necessarily define comfort for them and like comfortable. So comfort and like confident expressing opinions are like different. But I think like deeper dives into that, maybe more specific questions could help tease some of that out.
Did you have a gender question? Was there any difference on what the gender of the physician was or the patient? I'm just curious.
We had a question about gender of the patient, but I did not have a question about gender of the physician.
Not for any point making, just out of curiosity,
Yeah.
I think you did a great job.
Strong
work. Sorry you didn't get to do it at the big meeting. So
live and let live. COVID has changed lives.
Were you able to submit your poster to any other research opportunities?
So I submitted it to the National Conference on Adolescent Health that was being held in Michigan this year, and it was accepted, but they aren't doing online posters, but they're going to try and get us next year that we're accepted. And then I've actually applied to the National AAFP conference because they're doing virtual poster presentations.
Wonderful.
Oh, good. I wondered what they were going to do with that. So we'll have to look for you there.
Yeah. Fingers crossed.
Yeah. Hope so. Good luck.
Thank you so much. I really appreciate it.
Well, Victoria and Dr. Gruenbacher, thanks for joining us today this is our first virtual poster presentation. Yes, we hope to have several more that we can post on our website for our members to learn from. So thank you so much for your time.
Thank you.
Thanks.